All right, good morning, everybody, and thank you for coming out to our press conference today. My name is Dr. Michael Goodstein. I'm a neonatologist at Wellspring York Hospital. I'm also the director of the York County Cribs for Kids program and a member of the American Academy of Pediatric Task Force on SIDS. Today we'll be talking about SIDS, and this month is SIDS Awareness Month nationally, as well as Infant Sleep Safety Awareness Month. And so we're very grateful for having the mayor here today. Mayor Bracy will be making a proclamation about SIDS. We also have Pam Gay from the coroner's office, who will be making some comments about the local data about these tragedies that are occurring in York County. We'll also have Elder Judy Ritter-Dixon from the Fairview Full Gospel Church, who will be making some comments about the church's involvement in education, working with families with bereavement, and some personal comments from her own experiences with this type of tragedy. I'll be talking last to discuss safe sleep recommendations, as the American Academy of Pediatrics just came out with the new recommendations for 2016 on infant sleep safety and risk reduction for SIDS. We also have some other people in our audience who I'd like to introduce this morning. We have Dr. Matt Howie, who is the medical director from the City Health Bureau. We also have other members from the Health Bureau as well. We have Helen Lehman from Community Health Improvement, who also runs the York County Safe Kids Coalition. So thank you again all for being here, and I'd like to introduce Mayor Bracy.
Good morning, everyone. Good morning, everyone. It's always good to see you all, and thank you, Dr. Goodstein. It's always good to see you, sir. Appreciate your leadership in our community on this important topic. I do have a proclamation, as he's indicated. It's always good to see other elected officials as well, too. Our dear friend Pam, thank you for being here, ma'am. The proclamation reads, Sudden Infant Death Syndrome Awareness Month, October 2016. Whereas the month of October is designated as Sudden Infant Death Syndrome Awareness Month to focus on generating public understanding, compassion for bereaved families, and support for medical research. And each year, Sudden Infant Death Syndrome, SIDS, the sudden and unexpected death of apparently healthy babies, is the major cause of death of infants between the ages of 1 month and 1 year. And recognizing SIDS Awareness Month will provide us with an opportunity to increase our understanding of the great tragedy involved in the deaths of newborn babies. And SIDS Awareness Month enables us to consider how, as individuals and communities, we can meet the needs of bereaved families and work to prevent the causes of sudden infant death. Now, therefore, I, C. Kim Bracy, Mayor of the City of York, do hereby recognize the month of October as Sudden Infant Death Syndrome Awareness Month, and urge parents, caregivers, and researchers to unite with governmental, business, and community service organizations to bring about a greater public understanding of the prevention of this heartbreaking syndrome. Given under my hand and seal of the City of York this 25th day of October in the year of our Lord 2016. And I'll present this to Dr. Goodstein and the entire team, but I do want to thank you all for your work that you do on this important issue. And it is an honor for the City of York, particularly our Health Bureau, to be a partner with you in this cause as well. Thank you.
Okay. Next, we'll have Coroner Pam Gay come up to talk about our local statistics and the impact it has on our community regarding SIDS and other sleep-related infant deaths.
Thank you all for being here today, and it was good to talk to some of you earlier. Among the most difficult cases that our office has to go to and attend to are the cases involving these sudden infant deaths, sudden unexplained infant deaths. Most of my deputies, I believe all of them, and myself would tell you that they are very, very difficult. They never get any easier. Year to date this year, we've gone to 4 such cases. This is down from last year's numbers. By the end of the year last year, we had 6 cases. I believe the year before we had 9. So we do believe we're making progress in this area. However, it's a constant educational process in our community. Sadly, it is still very much a reality for families, several families a year in our county. And in spite of our best educational efforts, these deaths do still happen, and it's devastation for the families, needless to say, who've experienced such loss. And while we don't feel the pain that the families feel, those of us who are doing that educating do somehow feel some of that, some pain, because we always ask ourselves, what could we have done differently? What could we do better? And sometimes that's the good that can come out of such tragedy, is ways to improve our process. We're here today to remind others that nationwide, we have made that progress. Obviously, the incidences of SIDS-related deaths has decreased drastically, we believe, in the last few years due to this message of prevention. And so we look at this as a task to continue our work, a charge that our work's not done. We're going to keep doing this. We're going to keep spreading the message. We would like to have, hopefully one day, a year when we would have no infant deaths in York County as well as in our nation. That would be wonderful. But at least that they would continue to diminish nationwide. That's our goal. So I know that there are other entities going to go into more detail, but I want to just repeat a simple message that we try to send to our families and when we're out in the community: of hope and prevention. Back is best. Nothing in the crib but the baby in a sleep sack or with a light receiving blanket. Now we're hearing the new guidelines with the baby to sleep in the same room, which I'm sure you'll hear more about in a minute. These simple measures will help ensure that these babies survive well past their first year into adulthood, and they will survive that risk of death that is many times preventable. So thank you again for the opportunity to be here today, and we look forward to working on this cause together.
All right, thank you so much, Pam. Next, I invite Elder Judy Ritter-Dixon to come up, and we'll hear a little bit about her personal experience and also the church's role in helping families through the grieving process.
Good morning. Thank you, Dr. Goodstein and WellSpan, for inviting me. I first learned about SIDS while being a lay leader with the WellSpan Community Project under the auspices and facilitated by Joanne Henderson. And as a lay leader, it was our job to make sure that the information about SIDS got out into the community. But earlier on in 2014, I had experienced the death of our 5-month-old grandson, not understanding SIDS until I got more involved with WellSpan and their efforts to make sure that the information was disseminated, that I understood what it meant and how it affected us as a family and how it affected us as a community. I think that it is very, very important that we get this information out through our churches, through our community, even though we've done some work and we have accomplished some things in the community. I think it's more important for us to get back out there and talk about it. It was very devastating for my stepdaughter, for us, not knowing how this happened, because we thought the child was resting safely, that we had him in a safe place. He was in the bed, not knowing that that's not where he should have been. So I think that we should always continue to get that information out to the community and help them understand more. And I also counseling for the people once they go through it, because the church gives counseling and we give them the spiritual counseling, but I think there should be more education and more counseling as it relates to the family as a whole in the community. Thank you for inviting me, thank you for listening, and thank you for your time.
Thank you so much, Judy, for sharing your story with us. I appreciate that. I'm going to spend some time talking about what we can do as a community to try to reduce the number of these tragedies and talk about the latest recommendations that just came out yesterday from the AAP. Sadly, about 3,500 babies die suddenly and unexpectedly every year in this country. It is a national tragedy. If you do the math on this, that comes out to one baby dying about every 2.5 hours of every day of the year. And although the birth of a baby is a wonderful time in a family's life for being happy and rejoicing, it's important that we talk about these things, because if we don't provide education to people, then they can't make the best decisions for keeping their baby safe in the home. Unfortunately, SIDS is the third leading cause of infant mortality through the first year of life, and between 1 month and 1 year of life is the leading cause of death of infants. Numbers and statistics are important, but it's also important to understand how these tragedies affect people. And I want to share a story with you from a very brave woman who I've gotten to know doing lectures with her, and she's been kind enough to share her story, and I'm going to share her story. It's Dayton's story. So here are her words. I was first advised to bed share or sleep with my baby when I was pregnant with my first child, Malaya. I was told by the pediatrician that it promoted bonding and breastfeeding, and I bed shared every night with Dayton just as I had done with Malaya. I used a firm mattress on the floor with no excessive bedding or pillows. I was not obese, drunk, high, or under the influence of medication. I was simply asleep. But on the morning of October 27th, I awoke to the screams of my mother-in-law, "You're laying on top of the baby." I closed my eyes for a moment, and that morning comes rushing back as if it were yesterday. I was lying on top of my baby. My shoulder was pressed against Dayton's face. His lips were slightly blue. I immediately picked up the baby and began CPR while chaos erupted in my home. I shut down emotionally in order to focus on breathing existence back into my child. I tried so very hard to save this little life, to no avail. The ambulance arrived, and in a flash, my son was gone. How could this happen to me? To my son? How could this happen? We arrived at the hospital and were told that our son Dayton could not be resuscitated. In the blink of an eye, we were thrown into a nightmare. I had to do things that I always thought my children would have to do for me years down the road. Choose a casket, decide what my precious little one would wear to be buried in, and somehow figure out what cemetery plot would be the appropriate place to bury my firstborn son, along with all the hopes and dreams I had for his life. I was left standing next to his tiny grave, and with each shovel of earth that was tossed upon his casket, I felt a stabbing pain in my chest as if someone was cutting my heart out with a jagged knife and burying it with my child. Along with the grief that comes with the loss of a child, I am also burdened with the knowledge that my son's death was 100% preventable and that he suffocated under my shoulder. I have said to myself and others countless times, if only I had heard about this happening, I wish someone would have told me. I share my story of loss of my precious Dayton in the hopes of saving another baby. If I can save one baby, just one, from death, save one other family from going through this hell, then to me it is more than worth the criticism and reluctance that I am met with at times. I don't ever want another parent to have to say, I wish someone would have told me. A very tragic story, and a very brave mother who's willing to share so others don't have to suffer her grief. So I want to review the recommendations that just came out from the task force yesterday. Please note that all the recommendations are for every sleep, at nap and nighttime, and is until the baby's first birthday. We will not have time today in this format to explain the reasons why we make these recommendations, except to say that they are all research-based. But we know that parents don't just want to be told what to do. They want to understand why they're doing it. So I encourage everybody to talk with the healthcare provider so they can understand what the recommendations are, why we make them, and work to have a care plan to keep your baby safe at home. The most important of our recommendations is back to sleep. It's not a new recommendation. It's been with us for 25 years. It was made in 1992, and the first 10 years after that recommendation came out, SIDS rate in this country decreased by 53%. This is one of the greatest public health care success stories of the late 20th century. Parents should know that once their children get a little bit older and can start rolling around, they don't need to keep repositioning, but they should always put the babies on back to start out when they put them down to sleep. Babies should sleep on a firm sleep surface, a mattress in a crib that's approved by the Consumer Product Safety Commission. And on top of that should be a fitted sheet. No other bedding or soft items are needed. No quilts, no comforters, no stuffed animals, no plush toys or pillows. Those are all things that the baby's face can get up against and create a suffocation risk, and they're just not necessary. Crib bumpers are not necessary either. If you're concerned about a limb coming out, the use of a sleep sack will prevent that from happening. We also encourage parents not to use car seats, swings, slings, or carriers as a place to put their baby to sleep. They're not safe sleep environments. We strongly encourage breastfeeding. There are many benefits to breastfeeding: reductions in obesity, reduction in the risk of diabetes, increased IQ, reduction of infections, and now we can add to that list a reduced risk of SIDS. Babies that are breastfed have up to a 50% less likelihood of dying of SIDS. And there's a cumulative effect, just like a medication. Consider it your baby's first medication. We recommend to share the room and not the bed. We never said in the past how long that should be. In the new recommendations, we recommend 1 year if possible, but certainly at least through the first 6 months, as 90% of SIDS cases occur in the first 6 months of life. It is okay to bring the baby into bed with you for comforting and bonding, but we recommend the room sharing because you can do all these things without having the baby in bed. If you choose to bring the baby into bed for feeding or for comforting, it's important that you remove all of the things from that surface that could be a risk for the baby, and that as soon as you're feeling sleepy, to make sure that that baby gets back into a safe sleep environment. We want to encourage parents to know that they should never, ever sleep with a baby on a couch or recliner, or even put the baby there alone to sleep. Sleeping with the baby on a couch increases the risk of SIDS 20 times, not 20%, but a 20 times increased risk of death. So you should never use that kind of sleep surface. We encourage pregnant women to get regular prenatal care and avoid drugs, alcohol, and cigarette smoking. We estimate that between 1/4 and 1/3 of SIDS cases would not happen if mothers did not smoke during pregnancy. We encourage the use of pacifiers to be offered to babies routinely at any sleep event. There is a high association of a decreased risk of SIDS when babies routinely receive their pacifier. Now, for mothers who are breastfeeding, that should be delayed until the breastfeeding is well established. And one should never force a pacifier on a baby or try to reinsert it after they're asleep or coat it with any kind of sweet or sticky material. Those things are unnecessary and not recommended. Do not overheat during sleep. Room temperature should be comfortable for the adult. So it's okay to use sleep clothing, baby pajamas, a wearable blanket, or a sleep sack are all okay. You should avoid blankets. Blankets can get loose. They can get up over a baby's mouth and nose and create a suffocation risk. People should be aware that vaccinated babies have a lower risk of SIDS. And finally, home monitors are not recommended because they do not reduce the risk of SIDS. However, if a family should decide to use a home monitor, it is still important that they follow all the safe sleep recommendations that we have outlined today. In finishing up, I just want to share one other story with you. It has to do with this Safe Sleep book, Safe Sleep, Safe and Snug, that's produced by Charlie's Kids Foundation, because there's a really sad story behind this. The people who run Charlie's Kids Foundation are good friends of mine now, Sam and Maura Henke, and they share their story because Charlie was their son, their firstborn son, and Sam is a pediatric cardiologist, heart specialist. And one day Sam came home and decided to take a nap on the couch with Charlie. And Maura's very straightforward about what happened. And she'll tell you that Sam woke up and Charlie did not. And Charlie died of SIDS at a month of age. In honor of Charlie, and to help other families not have to go through the grief they had to go through, they created the Charlie's Kids Foundation. They commissioned this book that has embedded in it safe sleep messages in a really beautifully illustrated story. We give this book out to every family at York Hospital before they go home with their baby as a gift to them and as a reminder to promote safe sleep. On the back of the book, all the safe sleep recommendations are on there. And the point I want to make with Sam and Maura is, here's a pediatrician, and that if this can happen to a pediatrician, it can happen to anybody. Thank goodness these events are rare, but when they do happen, they're irreversible. So it's really important, even if you believe you're low risk, that you make use of the safe sleep recommendations. Have a plan. We know every parent wants to do the best they can for their baby because they love their babies dearly. So work with your healthcare providers, make a safe sleep plan, and keep your babies healthy and safe. That's going to conclude the formal part of our conference today, but we will be available to discuss more information for those who want to obtain more. And thank you very much for attending today.